As Liz indicated, we are reporting out over 3,000 additional cases today. That's actually 3,023 cases. If you look, there was a minimal delay in reporting over the Christmas holidays, but honestly, guys, we are still seeing a lot of transmission out there, and this represents a lot of cases that we're still seeing and are being reported. If you look at today's deaths, we're reporting out an additional 29 deaths, but sadly, yesterday we reported out 85 additional deaths, by far the largest number of deaths we've reported out in one day. So we are still seeing a lot of transmission. It is still bad out there right now. And, we haven't even made it through the holidays yet. So we want to remind folks that, we've got some exciting news about vaccine that we're going to continue to talk and about, but we still need folks to wear a mask. We still need you to stay 6 feet away, avoid those large gatherings, stay within your nuclear family, except for those essential functions that you need to go out and do. So please, we encourage everybody to continue those actions as we go through the holidays. We are still seeing some stress on our healthcare capacity. We've got over 1,300 confirmed COVID cases in the hospital right now. And when you look at folks in the ICU, that's over 300 confirmed cases in the ICU. And of those, more than 200 are on a ventilator, and that includes one child. So, these increased numbers of cases that we're having translates into more hospitalizations, translates into more deaths. And so I would encourage everybody to remain vigilant and continue to be serious about limiting transmission. But we do have a foot in the door with vaccine, and we've had vaccine in Mississippi now for a couple of weeks. And right now we are still in phase 1A. Just as a reminder, that's a targeted priority vaccination for healthcare personnel in the state and for residents and staff at long-term care facilities. We have already distributed out a lot of vaccine in both of those efforts, to hospitals, to long-term care facilities, to continue to target those personnel. And moving forward, we want to continue to expand access and availability of the vaccine to those healthcare personnel. And when we think about the importance of healthcare personnel, these are the folks who have a high risk of exposure. So we want to make sure that they're protected. These are the folks who are taking care of our sickest folks and our patients. So we want to continue their capacity to stay on the job. And by vaccinating them and protecting them, we also prevent transmission from those individuals. So, like I said, in an effort to continue to expand the availability of this vaccine to all healthcare personnel in the state, we are announcing now that starting next week, we will have vaccination clinics at 18 sites throughout Mississippi, targeting specifically any and all healthcare personnel. And this is a broad umbrella. We want to make sure that we get those individuals who are in healthcare settings vaccinated. That includes folks like emergency medical services personnel, obviously nurses and doctors. It includes dentists and any of those administrative and support staff that are working in hospital settings, in clinic settings, in healthcare settings. And this will continue to be important for us. I want to let y'all know that we have received and distributed almost 120,000 doses so far in Mississippi. And that includes doses that we're distributing to our drive-through 18 sites throughout the state. That's more than 90%, or about 90% of the doses that we've been allocated so far. And remember, when we look at administration of vaccines, when we provide these allocations to locations and settings throughout the state, when doctors, when hospitals administer this vaccine, they need to report it back into our immunization registry. And so far in our immunization registry in Mississippi, more than 17,000 individuals have been vaccinated with a first dose so far. And that represents those healthcare personnel and some long-term care settings. So I'd like to turn it over to Mr. Craig to discuss how we're going to roll out these 18 clinics and the logistics behind that.
Yeah, thank you, Dr. Byers, and thank you all for being with us a little bit this morning. I would like to share some of the information about these 18 sites. As Dr. Byers said, beginning Monday next week, January 4th, we'll be opening 18 clinical drive-through sites throughout the state. Now, we're leveraging our existing testing infrastructure. If you're familiar with our drive-through testing, we provide in every county in the state of Mississippi, where many Mississippians can come and receive free testing if they're symptomatic or if they're a contact to a confirmed case. And in some cases, school teachers, child care workers, first responders, and others that need to be tested can come to these locations. The drive-through model has worked really well. In fact, we're testing over 2,000 folks almost every day in Mississippi through those drive-through locations. We're leveraging 18 of those locations, some of the ones with the higher throughput, to be able to provide these vaccination opportunities in a drive-through format for healthcare workers. I'm going to share a map just so you'll be able to see where these locations are. And then I'll tell you a little bit more about, can everyone see that map, Dr. Byers?
Yes, sir.
All right. So you'll notice these drive-through locations, the triangles in the county box are the locations in each of the geographic testing regions that we have. And we have 9 of these geographic regions that we do testing in. We've provided 2 sites, and in most cases, the high volume sites for these vaccination efforts to continue. They're very much like we use UMC as our partner to schedule testing. We will use UMC as a partner to schedule vaccinations. These sites require an appointment, just like we do for the testing components. So individuals need to go online, and the website is covidvaccine.umc.edu. And there they will be able to register for an appointment at one of these 18 sites. For those that like to look at information a little bit different, let me share another presentation of the data. So here are the counties, the 18 counties that we'll be operating in, and the days that we will be providing vaccination opportunities in those counties next week.
Mr. Craig, we can't see that. I think we have to stop sharing and share again.
All right, let me do that right quick. All right, can you see it now, sir? All right, so these are the 18 counties listed out along with the dates of next week when we will be in those counties providing vaccination opportunities. And those are the ones that individuals will be able, healthcare workers that are eligible can schedule an appointment on any of these days in any of these sites, not just where they live. They can go to areas where they work or other areas surrounding them. So signing up is, again, at covidvaccine.umc.edu. And we definitely want to thank our partners at the University of Mississippi Medical Center for working with us in both the testing effort as well as the vaccination effort. At these sites, very similar to what you see in testing, there will be public health nurses to assist in the administration of the vaccine, as well as Mississippi National Guardsmen that are vaccinators. Those particular vaccinators are some of our combat medics from the Army National Guard, as well as medical personnel from our Air Guard that will be assisting in the vaccination efforts at these locations. So with that, that's a little bit about the good news. Like Dr. Byers said, it's a light at the end of the tunnel, I believe, for many of us in this pandemic, this terrible pandemic that we've been in. So we're very, very happy that this opportunity is available for healthcare workers, again, in 1A, to receive this vaccination. With that, Liz, I'm going to turn it over to you for some questions from the group and see if we can give them some answers.
Okay, can you do me a favor, Mr. Craig, and get out of that?
I can.
Okay, wonderful. Okay, so I think y'all have addressed some of this, but I'm just going to go ahead and read them. Kingfish from the Jackson Jambalaya, is asking about the 4,500 doses that the New York Times reported, which we know is not accurate. Did you not say that 17,000 Dr. Byers have already been vaccinated with the first dose?
Yeah, that's correct. And it's important to remember that, there can be a delay in entering that data into our immunization registry from the hospitals and the facilities that are out there doing the vaccination. And so there's going to be some inherent delays. But it's also important to understand that number is updating constantly as we get more entries of vaccinations administered into that system. And when we looked at where we were this morning, 17,410 vaccinations had been administered so far in Mississippi. We are going to be putting that data up on our website later today. So I encourage everybody to look for that. It'll have some demographic information and have the number of doses that have been reported administered on a weekly basis. And we anticipate that number to continue to grow in the coming days to weeks.